Hi, good morning, Patrick. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 30th of December 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Patrick Soberg.
All right, Patrick, could you please confirm your candidate number?
Yes. My candidate number is 42345423448.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
How would you handle a situation in which you couldn't read a prescriber's orders?
In cases where it's challenging to decipher a prescriber's orders, a systematic approach is essential. Firstly, I'd rely on experienced colleagues for guidance. Cross-referencing the patient's case notes and analyzing the context of the situation can often lead to a sound decision. When necessary, I wouldn't hesitate to seek assistance from fellow healthcare professionals. As a last resort, if clarity remains elusive, I would consult with the prescriber directly. It's imperative that I refrain from making assumptions, as patient safety is paramount, and guesswork is never a justifiable approach.
What was your favorite clinical experience? Why?
One of the most impactful clinical experiences I cherish is the case of an unconscious individual who attempted suicide by ingesting a toxic substance, resulting in severe brain damage. The patient's condition was critical, with recurrent respiratory distress. Over time, as the patient regained consciousness, they began responding positively to the care provided. This experience stands out as my favorite, because it highlighted the profound significance of compassion and nurturing in healthcare. It underscored the importance of offering genuine care, even in the most challenging situations.
Have you ever done any volunteer work? If so, what was it like?
Absolutely. I had the privilege of participating in volunteer work during my final year of college. As part of World Health Day initiatives, our college and hospital management organized a blood donation camp in collaboration with the Community Health Center. I was selected along with a few of my peers to assist the hospital staff during the event. We were actively involved in various aspects of the donation process. This experience holds a special place in my heart, as it marked my introduction to volunteer work, and I thoroughly enjoyed the opportunity to contribute to a meaningful cause.
How do you motivate patients?
Motivating patients is a fundamental aspect of healthcare. Patients often experience stress and anxiety during their hospitalization, and it's crucial to foster a sense of trust and calm. I begin by greeting patients with a warm, welcoming smile, which can instill confidence. Effectively communicating their medical situation in a calm and understandable manner, using language they are comfortable with, helps alleviate anxiety and prevent overthinking. I always aim to inspire optimism by using words and actions that convey hope and reassurance.
How do you set priorities in your work?
In the medical field, every task carries its own level of significance, and each deserves due attention. Therefore, I approach my work with a commitment to complete every task in a timely and efficient manner. However, adhering to the triage system, I understand that emergency situations take precedence, as they require immediate attention and care. It's my responsibility to ensure that all tasks, regardless of their priority, are executed with diligence and professionalism.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. I am Nurse Patrick Soberg. Am I talking to Mihiraa?
Yes, that's right.
Wonderful. I will be attending to you today. The doctor mentioned you're heading to Southeast Asia for work next month.
Exactly. I'll be visiting a few Southeast Asian countries for about 3 weeks. It's my first time visiting that region, so I'm a bit excited, but I also wanted to make sure I'm properly prepared.
That's a great idea. Travel can be an amazing experience, but it's always important to prioritize your health and well-being. Mihiraa, let's start by discussing your travel plans and vaccination history. Additionally, we'd like to coordinate with you to schedule a vaccination appointment. Before we start, do you have any specific concerns or preferences?
Not really. I just want to make sure I'm getting the right shots and avoiding any potential health risks.
Absolutely. Vaccinations are crucial for a safe and healthy journey. Mihiraa, they act like invisible shields, protecting you from potentially serious illnesses, like typhoid, hepatitis A, and tetanus. Think of them as an investment in your health, minimizing risks and unplanned medical expenses during your trip.
That makes sense. I wouldn't want to get sick and ruin my entire trip, of course.
Exactly. Now, to recommend the most suitable vaccinations, could you please provide some details about your trip?
Sure, why not? I'll be spending a few days in the capital cities, but also visiting some smaller villages and rural areas.
Great. And what about your vaccination history?
To be honest, I think I had childhood immunizations like tetanus, but I'm not sure about anything specific, especially for travel.
Okay, that's helpful. Based on your trip details and vaccination history, Mihiraa, we recommend some pre-travel vaccines. I wanted to emphasize the importance of vaccinations for your health and safety. Tetanus, in particular, can be a serious concern. It's recommended once every 10 years, so ensuring you're up to date is crucial. Additionally, I recommend considering a combined vaccination for hepatitis A and typhoid. This not only provides comprehensive protection, but also offers convenience. You can get a booster after 6 months to ensure sustained immunity. So, Mihiraa, would you be comfortable scheduling an appointment for your vaccinations 2 weeks before your departure?
2 weeks makes sense. I wouldn't want to be dealing with side effects while I'm on the other side of the world.
Your thought is appreciable. The ideal scenario is to get vaccinated about 2 weeks before your trip. This allows enough time for your body to build optimal immunity and manage any potential mild side effects, like soreness or fever, comfortably before you travel.
Absolutely. I'd rather be safe than sorry, and it sounds like these vaccinations are essential for a healthy and enjoyable trip.
Wonderful! I'm glad we're on the same page. I'll go ahead and schedule your appointment now. Mihiraa, would you like any additional information about travel health or resources for your trip?
Not at the moment. It's okay.
All right. Mihiraa, before concluding, let me summarize what we have discussed so far. Mihiraa, we've covered essential aspects to ensure your health and safety during your upcoming trip to Southeast Asia. We began by understanding your travel plans and vaccination history. Considering your visit to both capital cities and rural areas, we recommend pre-travel vaccines for comprehensive protection.
Okay.
We emphasized the importance of vaccinations, highlighting the role they play as invisible shields against serious illnesses like typhoid, hepatitis A, and tetanus. Given your tetanus history, we recommend ensuring you're up to date, as it's crucial and advised once every 10 years. For added convenience and comprehensive coverage, we propose a combined vaccination for hepatitis A and typhoid, with a booster after 6 months. Mihiraa, scheduling this 2 weeks before your departure allows ample time for optimal immunity and minimizes the chance of dealing with any potential side effects while you're abroad. Your commitment to prioritizing your health and ensuring a safe, enjoyable trip is commendable. Mihiraa, if you have any more questions or concerns, feel free to share. We're here to support you in every step of this health journey.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.